Care for Peace is founded on what I believe is a time-honored truth. There is a direct correlation between providing care through public health and public security services to the disenfranchised people of the world and the peace desired by both the government and the governed. On a personal level, Care for Peace comes from right here. I care for my wife, I have peace. I care for my family, and I have peace. But that isn't the current reality in Myanmar. Peace hangs in the balance. Ancient tribal and ethnic animosities threaten the determination of a nation struggling to become a free market economy. Healthcare is almost non-existent for the 50 million plus people who live in barely accessible rural Myanmar. And while we know we are powerless to affect age-old hostilities, what we can do is help the government show the governed that they care, to provide a place, a healing place, a meeting place, a birthing place in rural townships and villages where basic health services will be available to all, regardless of their tribal or ethnic origins. Last year, when we met with the Honorable Minister of Health, Dr. Pei Tek-kin, to discuss our cooperative agreement, he expressed his resolve to provide health care to everyone in the country. The Honorable President Thein Sein also stated that health and education for all is a top priority of his administration. The Honorable Union Parliament House Speaker, Thura Shweman, showed keen interest in our Care for Peace initiative when we recently met with him in San Francisco this last July. When we heard the Honorable House Representative Aung San Suu Kyi answered just one question from her audience of 3,000 in San Francisco in September of 2012, we knew we were moving in the right direction.
When do we see the progress in Burma 5 to 10 years from now? Well, I don't think we can wait for 5 to 10 years. We'd better start seeing progress in 1 or 2 years because our people are in great need. Of course, we can't progress in all directions at once, but I think we should be able to see visible progress within a year or two, even if in small ways.
Yes, let's get started with something visible for people in great need. Within 1 to 2 years, immediately following initial funding, we are going to plan, design, build, and commence operation of the first prototype made in Myanmar mini medical center in Kyauk Phyu, Rakhine State, Myanmar. In general, the mini medical centers will be much smaller and less expensive to build and operate than large urban medical centers, and will be within reasonable walking distance of people's homes and villages or townships. The 3 core modules are designed for expansion and will include an outpatient module, an inpatient module, and a community health module. The outpatient module includes general medical care, minor emergency care, and specific women's and children's health programs, including prenatal and well baby care. The module will also include basic laboratory and radiology services, as well as a dental suite and a pharmacy. The inpatient module includes operating rooms for major and minor surgeries, as well as for complicated deliveries, and will be adjacent to a future birthing center. The community health module includes health screening, immunization service, health education, and wellness. University teaching hospitals, central district and specialty hospitals and medical centers will supply all the traditional acute medical and surgical services for their local populations, yet they will be also utilized by many medical center patients requiring higher levels of testing, treatment, and care services. While it will take many years for the country to build a nationwide grid of reliable public utilities and systems including electricity, telecommunication, clean water, sewage treatment, roads, public transportation, among others, the mini medical center facilities are being designed to be sustainable and self-sufficient, relying solely on standalone utilities and systems. Solar power will provide electricity to the mini medical centers to power clinical testing and treatment equipment. Solar power will also enable telecommunication systems that are required so that each center is teleconnected in real time with the world of medicine via computers, mobile phones, and tablets. We will be using currently available computer applications for patient records. We will also be utilizing currently available webcam video technology for individual group health education, health worker communications, and real-time first and second opinion telemedical consultation. Looking down the pipeline, once we have built one or more mini medical centers, we will initiate a mini medical center telecommunications support system between all facilities and will connect to some of the main large medical centers in the city. In my opinion, peace hangs in the balance only when something happens that tilts the balance that gives people real hope. Our hope is that the mini medical centers will exist as small, visible beacons of lasting hope for people in great need. Sustainable health care can assure sustainable public hope. We are honored to have the active participation and sage advice from our Care for Peace board members. We are also carefully listening to the invaluable knowledge and experience of the Union government, the Ministry of Health, the Public Health Foundation, and the people of Myanmar, whose advice regarding what they need for their country and what they want to do to bring health care to all the people is already integrated into our evolving model of the mini medical center. The result will truly be made in Myanmar, built with the people of Myanmar, built for the people of Myanmar, and operated by the people of Myanmar who care for peace, as do we.